My name is Dr. Joslyn and today we will be talking about sciatica. Now, sciatica has become a very common health issue and today we see about 43% of the working population affected by it. Sciatica is a broad common term that is used to describe a pain that occurs in the lower back and extends down the legs. Now, this commonly affects males as compared to females in the age group of 40 to 60 years. Now, if you see the sciatic nerve, it is the longest and the thickest nerve in the human body. It originates in the lumbar and the sacral area. That means the L4, L5, S1, S2 and S3 nerve roots join together and form the right and left sciatic nerve. It runs down the legs from the hips to the buttocks and ends right below the knee joint, where it further branches and moves down to supply the lower part of the legs, the foot and the toes. Sciatica usually affects one leg at a time. However, it is possible that both the legs will be involved. So it is basically where the sciatic nerve is getting pinched, whether it's L4, L5, S2, S3 or S4. And the areas that is supplied by these nerves where the symptoms are more heightened and accordingly that particular area is affected. The commonest cause for sciatica or a sciatic nerve compression is a herniated disc. Apart from this, there can be a degenerative bone disease or arthritis, spondylolisthesis or a lumbar stenosis. Now, depending on the cause is how the symptoms come along. Like if you have a sudden appearance of the sciatica symptoms, if you have a herniated disc, but the symptoms appear more gradually if it is because of a degenerative bone disease. A herniated lumbar disc is a result of age-related wear and tear that results into the disc degeneration.
As the disc degenerates and breaks down, the inner core can leak out through the outer portion of the disc. This condition is known as disc herniation. This puts a direct pressure on the sciatic nerve.
Degenerative disc disease is often a result when the cushioning between the vertebrae began to wear off. Now, this is commonly seen in younger adults above the age of 40 and as a result of an existing bone disease, injury or a trauma.
In consequence to aging or trauma, the intervertebral disc can be damaged or degenerated. Loss of the disc height can cause a bulging of the disc, putting a direct pressure on the sciatic nerve.
The most commonest cause of lumbar stenosis is the wear and tear changes that occur in the spine because of arthritis.
Disc degeneration and facet joints overloading can cause an arthritic overgrowth. This causes a narrowing of the spinal canal. The stenosis or narrowing of the canal causes a pressure on the spinal cord or the nerve roots that exit from the spinal cord to the muscles, resulting into the pain or cramping experienced in the legs by the patient when standing for prolonged periods or while walking.
Spondylolisthesis is very commonly occurring in young adults, especially the athletes. Now, this is because their strenuous physical activities which is done by them, like for example gymnastics or football, tend to put a lot of stress on the bones of the lower spine, which results into the spine or the vertebrae to slip forward.
Spondylolisthesis is a common lumbar spine problem that makes the disc unstable and allows the upper vertebrae to slide forward. When the slipped vertebrae puts pressure on the sciatic nerve, it causes the pain in the lower back or the legs.
Homeopathy is very effective in treating the cases of sciatica. In my clinical practice itself, I have seen patients improve so wonderfully with homeopathy. The homeopathic treatment requires a careful examination of all the symptoms presented by the patient, as well as understanding the disease pathology, understanding the depth of involvement or the depth of progression of the disease, how much of the tissue, muscle or bone is involved. Now, along with this, we need to study what are the other factors that exist within the patient, making him or her prone to developing the disease. Suitable remedy is prescribed after the careful examination of the symptoms. Now, homeopathic treatment will not only provide pain relief, but also we will see improvement in the range of movements, improvement in the strength of the lower back and the leg muscles, and in some cases the pathology can be reversed. There will be also improvement in any of the osteoarthritic changes that exist. Some of the commonly indicated homeopathic remedies that are used in cases of sciatica are most commonly indicated medicine is colocynth. Now, along with colocynth, you will see that magphos is also commonly used. Both of them are very similar in their symptomatology. So you will see colocynth indicated in patients who have a left-sided sciatica, whereas magphos is indicated in patients with a right-sided sciatica. Both the patients, the pain is better by warm applications, warm fomentations, covering the affected side, and better by pressure. In colocynth patients, you will see the pain is better by lying on the left side. Rust ox is often indicated in patients where there is a history of heavy lifting or some kind of a sports injury. The pain is at its peak when the patient is sitting in one position for a prolonged duration of time, and when he gets up and once he starts walking about, so when there is a continued motion, the patient feels better. Now, nephallium is very commonly indicated in patients where the sciatica symptoms are often associated with numbness or tingling, which is found in the lower limbs. Now, also the patient complains of weakness on the affected side. We also see that the pain is often restricted to the calves and the feet. Bryonia is indicated in patients that have sciatica commonly occurring on the right side. Now, these patients also have heaviness in the affected side. All his pains are aggravated by motion and is better by rest. Kali iode is typically indicated in sciatica pains that is associated with a formication sensation in the legs. Now, typically these patients wake up suddenly in the middle of the night complaining of pain, and walking about provides some amount of relief. Arnica and hypericum is often indicated in cases where there is some kind of an injury, whether it is sports injury or a fall or an accident. But these two remedies work very beautifully in such cases. Sciatica and lower back health problems can be prevented by making simple lifestyle modifications. Now remember that these modifications should be constant and they should be practiced every day. So first of all, it is important to learn and practice lower back and leg strengthening exercises. Secondly, important to get a very suitable footwear, with good amount of cushioning. Third, before exercising or before doing any kind of gym exercises or walking, it is important to warm up. It is important to stretch. It is important to cool down. Fourth, you have to maintain a healthy weight, eat a nutritious diet and drink plenty of water. And the last most important thing, to relax and rejuvenate. Now, it is very important that you de-stress, because stress tends to put a lot of pressure on the lower back muscles. So you need to get involved in some relaxation techniques, or just time out, or just take care of yourself. Whether it is getting involved in some of your favorite hobbies, or painting or singing, whatever helps you to de-stress. So it is very important that you bring about these small changes into your life and prevent any kind of lower back health issues.